Good morning, everybody. Today we're going to go over your finals, at least my portion of it. So here it is. The first one that you want to look at, I have 16 questions, is all that are my portion of this test. On the first, you want to look at safety considerations for your IV infusion therapies. Um, and if you'll notice, the second one says with potassium, you want to look at both the just plain infusion therapies and your potassium therapies for your safety considerations. What are you going to look at as far as IV sites? You need to know about what you need to look at with potassium therapy before you start it, during the running, and afterwards. Okay, the next one is your assessment considerations for hypocalcemia. So, what parts of an assessment would you note that are indicative to hypocalcemia? Like what signs and symptoms are there out there? The next one you're going to have, it says one question, and that's what these ones are out here by. One question, but on the next one it's values of CBCs and electrolytes. In other words, you need to know your norms on these, and there's going to be probably one question on your CBCs and at least one on your electrolytes too. Okay? Excuse me. Next is dietary considerations associated with your hypophosphatemia. Remember that phosphorus and calcium play off of each other, so they do the reverse of each other. So, what type of dietary considerations do you need to have for somebody that's hypophosphatemia? Okay. Next is your fluid calculations. Of course, you need to know how to figure your fluids. Make sure you get both the pump rate and the drip rates down pat. Okay. The next is your best practices for end of life care. So, what are our best practice considerations for someone that's at end of life? What if you have someone in respiratory distress or something like that? You would want to make sure that you have orders for morphine and what are the best practices to do stuff like that. Okay? Distinguish between your theorists. You need to know the difference between Levinson and Haverhurst, and each of the different theorists out there, like Erickson's, Levinson, and Haverhurst. Okay? And then your health history considerations for your elderly that are specific to your elderly, such as, this goes with the next one too, like the preventative health in the elderly. So what are considerations? What do you need to do in their households to keep them safe? What type of preventative do they need? We went over this at the very first of the semester. So go back into those two chapters and look that stuff over real well. Like what immunizations are considered important for the elderly and that type of thing. Best practices in treatment of sickle cell disease and sickle cell crisis. You need to look those over and make sure that you understand what the nurse needs to do first, and what are considered best practices in this. Your pathological considerations for thalassemia is another area that you need to know. So, what is going on? What causes thalassemia? Make sure that you understand the pathology of that. Okay, health history considerations for your patients with Hodgkin's lymphoma. So, what parts of the health history do you need to pull out for these patients? What would be indicative of someone that has Hodgkin's lymphoma? Medications that are used during sickle cell disease, you need to look those over, the ones that are listed in your med-surg book. Okay. Also, your medications that are used in your multiple myeloma, and those will be the ones that are discussed in your med-surg book. I'm not expecting you to go back and look at everything in your pharmacy book. Okay. Okay, presenting manifestations of aplastic anemia. what do these patients present with, what can cause aplastic anemia. These are the things that you need to look for with these. If you will just concentrate on these areas, you should do very well on my portion of the test. I wish every one of you good luck, and I appreciate the opportunity to teach you. If you have any questions on any of these, please feel free to call me or text me, email me, whatever, and I will be glad to help you as much as I possibly can. You have a good week, and thank you. Bye.